Dr. James Mobley, not Mobley, Mobley, and I'm the health authority for San Patricio County. Yes, measles is a virus, and it's one that when I was growing up, we just accepted was there. Now that we have a treatment for it or prevention for it, start that again. Now that we have a prevention for it, we really hardly see measles anymore, but it's still quite a dangerous disease. One of the characteristics of measles is if a person catches measles, they will infect 9 other people before they're diagnosed. This is it's probably the most contagious disease in the world. And that's one of the very dangerous things because they will infect people before they even know they have measles. So this is how it's spreading now. It's also spreading, of course, in people that are unimmunized. But even people that are immunized, especially folks that have problems with their immune system, people with cancer, children with chronic diseases, even if they've had the MMR vaccine, can still catch the measles. Generally, measles is mild. Of course, it has a rash, a very characteristic rash. Along with that comes eye irritation, the runny nose, kind of the classic things you see with the virus. Very rarely, though, it can get pretty severe. It can turn into pneumonia and encephalitis. That is, it can infect the brain and cause brain swelling, and that's quite dangerous. About 1 in 1,000 measles cases will die, although older people, age 30 and older, it's almost a 5% mortality rate. And in children under 6 months of age, it's about a 3% mortality rate. So at those two age ranges, it's really quite a lot more dangerous. No, not in my career. The last measles case I saw, I think, was around 1990, and it was an isolated case. Again, back when I was growing up, we saw measles all the time, but amazingly, this MMR shot has eliminated that. And again, it's a very dangerous disease, so it's very important that people get immunized. If they're not sure if they're immunized, they should check with their healthcare provider, and they can easily provide it, or pharmacies have the MMR too, or local health departments. There's lots of ways to get it. I would call this very concerning right now. It's, it basically, so far it's been fairly isolated, but if you look at that doubling rate, it's really spreading very quickly. And again, it's very likely that it will spread throughout that area. I think there's a good chance we will see cases throughout Texas. The most important thing, if we can get the immunization rate up, we need it well over 90%. Then we can stop this before it gets loose. But it has a potential to really cause quite a lot of problems within the state and even throughout the nation. I think there's a good possibility of that. Basically because people will spread it before they know they're sick, and traveling all the time, I think we'll see it spread and basically from pockets. One person has it, 9 other people get it, they spread it. So I think it's probably will move across the state. Health officials, certainly at the Department of Health, State Health Services, are going to move very rapidly on immunization programs. And I'm going to be visiting with my immunization people to be sure that we're doing everything we can to get the immunization rate as high as possible. The risk is for people that aren't immunized, either by choice, their family has decided not to get that, or the first shot is not until 15 months. And so children below that age are vulnerable, and so our very youngest are very vulnerable, and always our very oldest people are vulnerable too. Really, all it takes is one infected person to hop in their car and go to the beach and say, I'm going to Corpus Christi, for spring break. And by the way, that's going to be a very high risk thing. But one person hopping in their car comes down here, gives it to 9 more people, they give it to, and suddenly, we're not dealing with tens or 20s, we're dealing with hundreds and thousands. This is a dangerous disease. First of all, children below the age that can't be immunized yet. So basically newborns up to about 1 year of age. And make sure that everybody that is in the household is immunized. Now, this is a live virus, therefore women that are pregnant should not receive this virus but any lady who's thinking of becoming pregnant should definitely be immunized for this before they become pregnant. And again, everyone in the household should be immunized, and a little bit of caution, especially daycare centers and things like that. We have a requirement that people have the immunizations in daycare centers, but there's exemptions, both medical exemptions and exemptions for conscience. And we've seen those exemption numbers go way up since COVID. We're very concerned about that, and they seem to continue to be rising. And that makes basically the whole population vulnerable, even people that have received the vaccine. On the other end of the spectrum, again, anyone over 30, for adults, measles is a really severe illness. When I was a kid, a couple of days and that was it. But adults get this, that's when it can go into encephalitis and pneumonia and these things. And especially elderly, someone who's had cancer or something like that, they may want to check with their physician and see if they need to go ahead and get another shot. There's not real clear data on that. We basically say, well, if you're not sure, probably should get one. So I recommend, if they're not sure, talk to your physician or your healthcare provider and see if you need to get a booster shot. But definitely in vulnerable populations, those families, everybody needs to make sure they have the MMR. Yes, what we've seen in a number of places where they had high rates of exemptions is even folks who had the inoculation or the vaccine also had a higher risk of developing it. Although usually it's not as severe and not near the risk of unimmunized people, but it is a risk to the entire population when people don't get their immunizations. And again, in this particular one, because it is so contagious, you need 90% or more of people to have that inoculation to really provide what we call the herd immunity. Right now, one of the main things we're doing is making physicians and healthcare providers aware of measles, because many of us have never seen it. I've seen a lot of cases, but a lot of my younger colleagues have never even seen a case of the measles. So we're sending out information on the symptoms and what it looks like and some of the key findings. We're making our all the physicians and healthcare providers aware of what the symptoms are, what the rash looks like, so that if we do have a case, we can identify it early, quarantine, and make sure it doesn't spread, and also provide immunizations. This is moving so fast. Honestly, we're right at the beginning as far as how to do more MMR immunizations or further immunizations. The measles vaccine is available, and I'd certainly encourage anybody who either doesn't have the vaccine or is not sure if they're up to date, check with your healthcare provider. Local pharmacies have this too. Health departments have it. So there's a lot of ways to get it. Usually it's free, so they don't have to worry about cost, or very low cost, but almost always it's free. So that's the thing that people can do right now. We'll certainly be starting to take a look at, should we be providing special vaccine clinics or things like that. And there's a good chance that we'll want to do that. Well, number one, measles is a dangerous disease. Number two, there is the very good vaccine, the MMR. People should get that now. It takes about a week to kick in. And so I'd highly recommend anyone who either is not vaccinated or not sure, check with your healthcare provider, but get that MMR. That's the best thing they can do. People who are in either daycare centers, adult daycare centers, or childhood daycare centers, if they should make sure that their child or their adult is vaccinated. People that for some reason can't be vaccinated may want to consider staying home right now, staying away from crowds or things like that until we have more clarity on the situation.